Because you're feeling something, it doesn't mean that's who you are. Self-compassion is a very important aspect of resilience. The most important factor on wellness is friendships.
Welcome back to Generation S.O.S on Record. Today, I'm here with Dr. Tamerin. He's a clinical psychiatrist in Connecticut. He serves as a clinical associate professor at Cornell Medical College, where he has taught resident psychiatrists and medical students for over 30 years the skills of interviewing and psychotherapy. He's been twice honored by the graduating residents in the Department of Psychiatry and chosen Teacher of the Year. He completed his undergrad degree at Harvard College and completed his medical degree at NYU School of Medicine. Dr. Tamerin has done a ton of cool stuff, okay, guys? He served as a consultant to the alcohol and addiction program at New York Hospital for 25 years and currently serves as Generation S.O.S's psychiatric consultant. And he's committed to helping adolescents and young adults deal with mental health and substance abuse issues. He has done a ton of stuff, and I'm super excited. Thank you so much for coming on today.
Pleasure. I think perhaps a reasonable way to start is that I think peer support is a very, very important aspect of people coming to grips with an issue. And I've practiced clinical psychiatry for years, but I've also been very involved in facilitating a peer support group for people with mood disorder. And I moved to that having seen an AA meeting and how incredibly valuable that can be for addiction. And then I, for the last 25 years, run a pro bono support group of people with mood disorder and seen that very often people can hear and learn things from one another that they may not be able to hear or learn from a doctor or a professional. So I believe a great deal in what Robin and Jim have done with Gen S.O.S and what they're continuing to do. It's a very valuable way of educating people. Rather than having experts come in, you're having people coming and telling a story. And it's much easier for a young person to identify with another young person telling their story in a heartfelt and meaningful way than to listen to some expert talking about an issue. And they do a superb job in communicating heart to heart, very authentically, what they've been through. I think it's a very powerful force in educating people, in demonstrating the problems that arise, and also talking about the factors that lead people to use drugs and the psychological issues that they're struggling with, and helping people to realize how insidious it is and how it can easily creep up on them, and what may start out as sort of a benign habit or maybe as fun can turn out to be a tragedy. And it's been an honor to serve as their psychiatric consultant and to be able to attend many meetings and to contribute wherever I can.
And I think it's super cool how Generation S.O.S portrays how people have coped with their emotions and feelings and struggles in all different ways, and how they've overcame the hardships and cultivated the ability to face those emotions head on instead of avoiding them.
The question is how we deal with it. Are we prepared to face those feelings? Are we prepared to own them and perhaps talk about them? Or do we suppress them? If we're ashamed and uncomfortable about aspects of ourselves or about feelings which we feel are unacceptable, we're likely to find ways to hide from those feelings, either by defense mechanisms or pretending that we're not whatever it is we're feeling, or even more so by medicating those feelings, trying to minimize the feelings or to give ourselves momentary feelings of empowerment, which ultimately aren't empowering at all. In other words, the treatment, which is the use of alcohol or drugs to suppress the unpleasant emotion, ends up creating a whole new series of problems in itself.
Have you had any patients who have participated in Generation S.O.S currently or in the past?
Oh, I have. As a matter of fact, one of my patients actually became a speaker. He actually transformed his life enormously in the course of our work. And then subsequently, I think, further enriched it by his work with Gen S.O.S. In other words, the greatest way of maintaining a habit is by being a mentor. And then, in fact, by setting an example, it further reinforces our commitment to that mode of behavior.
What's the importance of feeling emotions and not identifying with them, right? I think that's two different things.
It defines our humanity. There are many people who are afraid of their emotions, and therefore they become a fraction of the person they could be. So feeling emotions, even uncomfortable emotions, is a very important part of being human. And frankly, if we're not able to feel unhappiness or suffering, we're often going to be incapable of experiencing true joy and true meaning in our lives. So it's very important to be able to permit ourselves to experience a range of emotions rather than suppressing them. But what's important is that if it's an emotion that you feel is unacceptable, it's important to be able to talk about it, not necessarily to exude it, but to talk about it so that one can ultimately manage it. Emotions are essential. What's important is that we be in control of them so that we use them in a constructive way, both for our own betterment and for the improvement of the world around us.
Is the reason why we minimize or suppress our emotions due to shame? And is that associated with depression?
Shame is a huge factor, Carmen. I think very often we feel ashamed of a lot of things, either about ourselves or about what we're feeling, and therefore we suppress that awareness and often keep it to ourselves. And the truth is, a lot of what we may be ashamed of, we may discover are universal emotions that everyone has if we can talk about them. I think what people feel is, if I express this feeling, or if I tell people that I have this emotion, or if I stay with this, that makes me different. It makes me unacceptable. They'll reject me. I'll be stigmatized. I'll be stereotyped. I'll be all sorts of things other than appreciated, accepted, and admired. And sadly, one of the things that I think makes us most admirable is when we can accept a wide range of emotions in ourselves and in others. That makes us most fully human. But that is one of the messages that I think Gen S.O.S conveys, that many people don't learn until they're much, much older. And I think that the sooner we get in touch with this, the richer and more rewarding our lives are going to be. And I think you hear this all the time. I'm sure you do with the young people you interview.
I think it's so cool. Like you mentioned with our speakers and with our podcast guests, like they didn't let their emotions get in the way of them sharing their story, of them getting through hard times, right? And not identifying with our emotions.
The sooner people can learn to do this in life, the richer their lives are going to be, and the more they can lead a broad and expansive life. I was reminded of something which sort of amused me that relates to this in a funny way.
Mm-hmm.
I did my last skiing when I was 79. I've skied most of my life, but my wife basically has a Raynaud syndrome, which means in cold weather, it's very, very unpleasant for her. So I said, could I go out to Vail one last time and ski once more, stay with friends? She said, sure, as long as you ski with an instructor, because I don't want you falling down on the mountain. So I went out with an instructor. I hadn't skied in a bit, and I'm about to come down the mountain. And he said to me, are you scared? And I said, no, I'm not scared. I'm scared shitless. And having said that, I suddenly felt free. And by the end of the afternoon, I was zipping down the mountain and very, very comfortable on my skis, not fearful at all. So what I'm saying is, had I pretended that I wasn't afraid, I probably would have been anxious all the time. As soon as I owned it, I wasn't anxious at all. I think we inhibit ourselves a great deal by suppressing our feelings and our fears. And as soon as we articulate them, they frequently disappear. And so people are uncomfortable about all kinds of feelings. And what's important is to be able to. It doesn't mean that just because you have a feeling you should articulate it. In many instances, one is well advised to not articulate it because it may be imprudent. On the other hand, it's important to be aware of those feelings, whether we articulate it or not, and not to be embarrassed by them. Because you feel furious at someone, you don't need to say, you know, express rage at them. Or because you're attracted to someone, you don't necessarily need to articulate that feeling. You can simply be aware of it, and that's a feeling. In other words, I think that one of the problems that people have when they use drugs is they feel free to say whatever feeling they have, and often it's very inappropriate. And somehow people often who are inhibited will use drugs to become disinhibited, and in becoming disinhibited, they not only are free to express their feelings, but they're also free to offend and hurt other people and to not be aware of it.
I'm noticing that I'm feeling some anxiety and then being like, I'm anxious, I'm stressed. What's the importance of that inner dialogue?
Because you're feeling something, it doesn't mean that's who you are. You might feel like you'd like to murder someone. It doesn't make you a murderer. A feeling is something that we have at a particular time. It could change in a minute. Part of what we need to learn are techniques sometimes for changing feelings, which people learn in a variety of therapies like DBT, et cetera, so that we can shift an emotion, and learning how to do that is a very empowering tool. Being able to be angry and then being able to enter a meditative state, and then the anger dissipates or disappears. But don't ever confuse an emotion with an identity. Identity is far more complex than that. Feeling angry doesn't mean you're an angry person. It means you happen to feel angry at some particular circumstance. And very often, as people grow and change, their feelings change about exactly the same circumstance that once was upsetting, which no longer perhaps is.
What you've stated this entire time is first talking about it. Huge, getting that off your chest, just acknowledging it to somebody else rather than self, and getting that out of your head.
Absolutely. I think we're social animals, and I think we need to be able to share what we're feeling with other people. As a matter of fact, that's a crucial aspect of mental wellness. Studies that have been done on physical and mental wellness in people who were in their 80s. This is a famous study that was done at Harvard College on people who are now 80 years old. The most important factor on wellness is friendships, meaningful friendships, where presumably a meaningful friendship is one where we can share things that are important to you with someone who listens to you in a caring, affectionate, non-judgmental way. That's what these groups are about. That's what we all need. And that's more important than economic success or social or success career-wise. And one of the things that creates emotional problems are feelings of isolation.
You're dropping some knowledge right now, Dr. Tamerin. I'm appreciating it, and I know everyone will too. Why is self-compassion important for our well-being? And what does it mean to have self-compassion and lack self-compassion?
I think so often people who are unhappy are highly judgmental of themselves, highly critical of themselves, and tend to see everything about them that's wrong or that they feel is wrong, rather than seeing what's right about themselves. So that compassion for another person would be feeling their pain, accepting them as they are, and making them feel welcome, rather than judgment. So often, even people who can be compassionate towards others are very judgmental towards themselves. They see everything that's wrong. I remember many years ago, I had a patient who was an architect, and he said to me, I'm going to tell you something that's going to really upset you. I said, I wonder, what are you going to say? And he says, I said, well, go right ahead. He said, I don't like your office. Now, my office is a very, very nice space. I like it a lot. It doesn't bother me at all. In fact, I feel very privileged to be in a nice space. And he went through telling me everything that he didn't like. And then I said, may I say something to you? I said, you found everything that you think is imperfect about my office, and you haven't seen anything about it that's admirable. I said, maybe the reason you're depressed is you have the same attitude towards yourself.
Wow. That's a great point, though.
Well, very often people who gossip a lot and who see all sorts of flaws in other people actually don't want to look at, but tend to be feel deeply flawed themselves. People who are very loving tend to be self-accepting. People who are angry and bitter may not even know it, but usually are very unhappy with themselves. Someone once said to me, a very wise man many years ago said to me, Dr. Tamerin, do you know the golden rule? I said, well, of course, love your neighbor as yourself. He said, yeah. He said, well, do me a favor. If you don't love yourself, don't love me. And I think that very often people who don't like themselves are constantly seeing flaws in other people, whether in relationships. People who are highly critical of other people tend to be very unhappy with themselves. They may or may not be able to notice that, but I think that they tend to be unaccepting often of things in other people and highly critical. They're going to be bumps in the road. They're going to be problems. And self-compassion is a very important aspect of resilience. And another dimension of self-compassion is that if people criticize you, and they will, instead of taking it personally, one can simply look at the validity of the criticism and either accept it or not accept it. But people who are very self-critical and lack self-compassion are often devastated by criticism of others, really can't relate effectively in work situations because they're incapable of taking criticism, which is an important part of growth. One has to be able to accept that without, and here's the point, we talk about the difference between feelings and identity.
Mm-hmm.
If you take self-criticism as an attack on your identity, you're not going to be able to handle it. If you have a positive feeling about yourself and someone points out something that might be better, you might even say, thank you, I'll work on it. In other words, if someone criticizes something you're doing, that's sort of like a feeling. It's just transient. It's something. It may be valid. It may be something to work on. But if someone hears it as they just said, I'm bad, what they're really feeling is, I feel I'm bad, and that person just spotted it. So that people basically have poor self-esteem or lack self-compassion are always going to be shame-based. They're always going to be keeping secrets. They're always going to be hiding. They really don't want people to know them. They don't want to open up because they're afraid that other people will see who they are and judge them as they judge themselves so that they can feel better about themselves. Every one of the talks that these young people give is a talk of going from a lack of self-acceptance to self-acceptance, which is so crucial in being able to achieve and maintain sobriety. If basically one stops using a drug, but still dislikes themselves and can't accept themselves, their sobriety is going to be very fragile because they're always going to be at risk of going back to something that gives them that quick fix.
Right.
Let me ask you this question, because this is maybe interesting to the audience. How has doing these interviews changed your life? And I'm sure it's given you a lot of very good feelings. I'm sure you've grown enormously since you started doing these podcasts.
That's a great question, Dr. Tamerin. I'm not sure anybody has ever asked me that, but I'll quickly try to sum up a few main takeaways I've gathered so far from doing this podcast. When we meet people or our friends and we're having a conversation with them, sometimes we really don't listen. We're just waiting for them to stop talking. And when they are speaking, we're forming a response in our head about how to reply back to them or bringing the conversation back onto ourselves. And you hear about active listening, and that's a big thing I've worked on and that I lacked before coming onto the podcast. Because it's so important to get behind people's eyeballs. Ask motivational questions, open-ended questions. You'll get so much more, and you learn something new from every person you meet. So while we have the chance, let's learn. While I'm sitting on these interviews, I'm ready to learn and have patience and grace with other people. We're all learning together, and we're all learning from each other. Lastly, I realize the importance of self-development with a lot of our podcast guests. And this is something I have learned before. A few years ago, I had this moment where I realized I was not living by my values. Hell, I didn't even know what my values were I didn't even understand what values were as in general, right? So I started getting more and more clear about what my values were. And to this day, sometimes I have to revisit, like, am I aligning with my values? Have my values changed? And I say all that because when I started getting clear about my values and when I started behaving in line with my values, so much changed for me. I started loving myself more and giving so much love out to my friends, family, peers, whomever, the world, if you want to say that. And there's such an important piece of self-development that I don't think is ever highlighted. When you work on yourself, you can give so much more to the world because you're not being, how you were saying earlier, people who don't have self-compassion, they let that out in other people. They're insecure, they gossip. And when you start living in line with your values, you really show your character, and it helps yourself, right? Like the self-development, right? It's for the self, but it really impacts your environment and the people you're around. And every person who's been on the podcast has also shown that. They've been through stuff, made mistakes, learned from it, failed, had accomplishments, the good, the bad, the ugly. They all right now are doing amazing things with their lives, love themselves, have great friends. And that's huge. Like you said earlier, having support group, excuse me. They all have bettered their lives from bettering themselves. It was like a huge ripple effect for them. And I really related to them on that. And it's just so cool. And I think that's something I really want to remind people. And I have to remind myself, like, when you work on yourself, everything changes in your life. It really does. But that was an amazing question, Dr. Tamerin. I have much more to say, but those are my immediate thoughts. And I'm very grateful for every speaker who's given me the ability to learn from them. So shout out to y'all. You know who you are. And this has just been a lovely experience chatting with you, learning from you. I am so appreciative.
We began by talking about the difference between a feeling and an identity. Well, as you talk about the clarity and clarification of your values, you're really talking about your identity, not just your feelings. Because as you become clear on what your values are and how your behavior is going to be contingent on your values, and that your values only mean something if they result in behavior that's in accordance with those values, that begins to define who you are as a human being, which is much deeper than a feeling.
For more conversations like these, or to find a support system near you, go to generationsos.org.